Karibuni 2020 and Karibuni back, those who've been on holiday and everything. We look forward to this new year. And as Reverend has said, that this is the year of holding on to the progress. Philippians 3:16. And why this? It is because upon reviewing the strategic plan, we have done a commendable job. Kila mtu can clap for themselves for that commendable job done. And therefore, I just want us to go back. You know, this strategic plan reads laying the groundwork for growth and sustainability. It is because it is exactly that actually the strategic plan is the tip of the iceberg. These 5 years were to just set the base for Kijabe for the next 100 years, for the next 200 years. And perhaps not just for Kijabe, but for the region. We remember our intention was to create an ecosystem or a healthcare system that questions the status quo in terms of healthcare in Kenya. That why can't the patient in Turkana access the same quality healthcare as that patient who goes to Mayo Clinic in the USA? Basically, what we were all about was to become the Equity Bank of healthcare. So, we want to just look back 2017, 2018, 2019, and then actually 2018 and 2019 because the strategic plan took effect in 2018, and look into 2019 and inform what will be some of our focus areas in the coming year. A snapshot, how did this begin? It began by, we remember we launched out very many processes which cost us a lot of money. The culture change audit cost us about 7 million shillings. We also did other audits that were done by PKF, which cost us about the same amount of money. So we put in a lot of resources to ensuring that we had the right information so that we could deliver on the right kind of activities. In 2020, and therefore we began that culture change process. Culture change was about our leadership. We are the ones who said this, that our leadership needed to improve so that it was more responsive to what we wanted. We wanted to have a better patient-facing situations. Our customer care was at an all-time low in terms of customer satisfaction or customer experience, amongst other things. In 2019, this is last year, we launched the BSC, Balanced Scorecard, so that everyone was reading from the same script. And we had also, remember, talked about the previous years, the performance measures had been viewed as punitive performance appraisal. And therefore, we wanted to introduce a system where we all agree at the beginning of a duration what we are meant to achieve, and then proceed to achieve that which we intended to. Governance was a big thing last year, and we managed to finally get, because the strategic plan talks about this, again, it is not me. It talks about competency at the governance level. We finally have that. We have engineers, we have doctors who are, their stature is such that they would sit in any governance, any board around the world and be competent. We have accountants, same thing. We have former CEOs, many people from different backgrounds, spiritual leaders, amongst others. And so now we cannot no longer say that governance is our Achilles tendon. And this animal called HMIS, I think we all know about it. The memory is still fresh. People like Kamau lost more than 50 kilos because of that. But here we are today. We are enjoying the product. Some challenges, but we are in a much better place than even where we wanted to be. Then 2020, the strategic plan talks about this is the year of restructuring and reengineering our business processes. This means a lot. HMIS was part of the reengineering and restructuring. 2 is looking into our staff establishment. 3 is looking into our processes, amongst other things. Why? Because we are trying to hold on to the progress. The strategic plan talks about all these activities. So if you have read the strategic plan, actually today's deliberations should not come as a surprise. So let's look at the first objective was stewardship, where we have consistently achieved 26% growth for the last 2 years. That is immense. Talking about 26% growth, we talk about any company achieving this. It has been an ambitious task. We've achieved it through many initiatives. It would be through introduction of various business lines, for example, the oncology services which have been escalated. It's been through just expanding of the existing services. For example, we know that some services like the OPD for some time, the numbers compared to 2017 to date have increased in as much as 40% of our patients' turnover. Streamlining our business processes. For example, in theater, we know that our waiting times in orthopedics have gone down from 1 year down to less than a month. So this has been achieved through a lot of effort, a lot of work. So makofi kwenu nyote. Now, where we've struggled is this cost to revenue ratio. Cost to revenue ratio inamaanisha basically, nikitumia Kiswahili, we are making a lot lakini tunakula yote. So we are generating a lot, but we are spending so much to generate. We had talked about a cost to revenue ratio of 85%. In 2019, we are at 94%. So this will be one of our key focuses this year, to look at ways to bring this down. Why is this important? If this cost stays up, it means that we cannot invest. The Kijabe that we want to grow cannot grow. We cannot put in infrastructure that leads to more growth. We cannot expand what we call capital expenditure. We cannot do capital expenditure if it means that we only have 6% to play around with in terms of reinvesting in various resources. So for goal number 1, stewardship, it will be now. This year's big focus will be to bring this cost to revenue ratio down from whatever it is, 94%, to where we are supposed to be as of this year, which is 85%. If you look at the strategic plan, it is something that we have consistently failed. Customer experience, I'll just focus on one there. If you look at the strategic plan, talks about many, but it talks about overall customer rating has gone up from 2018, which was 40%, 2019 it is 63%. This is no mean achievement. To make somebody happy is not an easy task. Even when you mean well. So, makofi kwenu nyote for that good work. But is 63% where we want to be? No, definitely not. Actually, the strategic plan talks about, by the time the strategic plan is over, we should be at 80%. Okay, but we are now at 63%. By the way, it is in green because as of this year, as of 2019, we actually achieved what we were supposed to achieve, which was 60% customer satisfaction. Now, this will be a big focus, and actually restructuring of even the leadership will evolve around addressing the customer experience pillar. It is about bringing the customer experience, feeling the pulse of the customer, even at strategic level, at governance level. So some of the measures that we'll put in place will be focused. So again, a big focus will be improving the customer experience. For example, We will still continue and look for strategies to bring the rudeness to 0%. There must be a zero tolerance to rudeness. And this is just another way to present it, and talks about just seeing the 33% one way or another. And I would put this 4% here, because you know, you do not want undecided customers. Somebody telling you that, you know, when African says they're undecided, it means they're not. Number 3 was affordable pricing. This has been a big thing. Again, how have we approached the affordable pricing pillar? It has been through working with partners so that we are able to deliver for those who are not able to pay for our services. So NEEDI program, in 2018, the SAFE program attended to patients to the tune of 16.4 million. This jumped to 2019 to 24.5 million. Is this the end? Is this the end of the road? Definitely not, because we know there are still countless number of Kenyans who are struggling to access quality healthcare services. Friends of Kijabe, this has been, again, a huge thing. We jumped from 2018 from 42 million to 61 million. And actually, if you look at that keenly, it still almost aligns to the 26% year-on-year growth. So everything, the magic number is really 26 for everything. The growth is what we focus on, is 26%, attending more patients, 26% more patients, therefore 26% more investment in resources, everything's about the 26%. And the local resource mobilization, we have been pushing for this, and kudos to those people who have put a lot of effort, has jumped from 1.2 million to 6.2 million. Now this is a dramatic, it's almost like six times. How have we achieved this? First, we have realigned the corporate office's priorities so that this is delivered better and resourced more, and we shall be resourcing even more to ensure that we get to where we are supposed to be. Actually, as high as it looks, this year's strategic plan talks about, I think, of 15 million. And the budget also talks about that. And the other thing is I would like to commend everyone who's put a lot of effort. You know, I know of nurses, doctors, managers, and everyone who has done their little to ensure that we match the resource mobilization. For example, last year, we got, I think, 1 million through Safaricom, and it was not even through the strategic initiatives. It was a doctor who went out of her way to bring this, to ensure these resources. I know of a manager who just went to the church, to their local church, and managed through the various groups to raise about 40,000 shillings. So it is those little initiatives which are leading to this. So you can be actually an ambassador for this period. Now, what has been our big problem? It is this pricing. You know, we talk about affordable pricing, but then last year we had to do increase of price. Why did we do an increase of price? Because last year was hostile. We know that one of the things was that NHIF was pushing us hard. Our patient volumes were going down. And so if we had not done the massive price adjustment, and also we had not done adjustments to keep up with the inflation for many, many years. So this was in order to meet the staff costs and everything. However, for 2020, the strategic focus will be on affordable pricing. How do we plan to do that? This year, there shall be no price increment. Therefore, the revenue growth and the cost reductions will come from other areas, but it will not be through our reviewing of pricing. Why is this important? One, it is because what we say in pillar goal number 3 is affordable pricing, but also I think it is the empathetic thing to do. After doing a year of massive price adjustment, I think we need to hold back even it makes business sense to do that. Operational excellence, forgive me for this ugly slide, but it is what it is. Focus on the message, not the messenger. The operational excellence, actually, if you look at pillar number 1, pillar number 2, pillar number 4, pillar number 5 and 6, it boils down to operational excellence. Just gearing everything to work in harmony to achieve this big objective that we set. We had said we shall have policies written to the tune of 80%. Now it's been difficult to measure this, but I can assure you, last year we did about 16 policies. These policy documents are big. It's not mean achievement. We've done a finance policy, we've done procurement policy, some of the ones that stand out: procurement policy, medical legal policy, capital projects policy, and then we've done various, the committees of the board have done their own job description. They are called mandates, okay, or charters. And the bylaws of the board have also been revised and updated to match the current times. The last revision is in 2015. Automation, this goes along with the HMIS. We are 90%. Actually, strategic plan for this year talks about 80. So, talks about last year talked about 80%. So we surpass that. But there's still a lot of work to do. There are still some reports to be generated. There are still some things that you're doing manually that need to be converted so that you are able to do everything. So this year's strategic plan, we've achieved what we needed to achieve. It's been a lot of work, but we need to get to 100%, and we hope that this will be achieved this year. Quality assurance strategic structure has been put in place to systematize quality and how we view the patient's outcomes, and that is in line with this. I know that the clinical division and the nursing division have done a lot of work in this area, monitoring things like pressures at strategic level, monitoring the number of DVT patients who happen to, and then catheter-associated bloodstream infections or UTIs, amongst others like surgical site infections. So there is a lot of work going on here, and we have invested a lot of resources because, you know, a serious institution is one which talks something and invests resources in that area. Number of patients receiving bills has jumped, and we actually can confidently say we are at 95% now. And this pre-qualification of suppliers was done. I think it has been a very participative process. And this is just memories of the go-lives that happened in the various institutions, and this was really one of the key highlights of last year. Now, to skilled workforce, we put in place balanced scorecard, and over 90% we're getting those, and they are aligning to what we are speaking about. The onboarding process was revised. Everyone, I remember when we started this process, the journey of the strategic plan, people were talking about, we don't know what you're supposed to do. I think everyone now has a JD, and if you don't, it is there. Just HR, look for HR, and then those processes. And then the leadership and governance, and I talked about this, a lot of work has been done. So, what do we look forward to? One of the things, if you have been following, is that this year is a year, actually strategic plan talks about we should be introducing very many service lines, and very many service lines will incorporate, for example, expansion of the oncology services, introduction of specialty clinics on the palliative building. We're talking about the capital, the budget that has just been approved, putting up of more satellite clinics so that we can go closer to the patient. About we intend to put, at least in the initial phase, put two more satellite clinics this year, to invest in more in the Nairobi clinic so that we are able to do more services. This will require a lot of resources, And therefore, if you've been following the slides, that is why we have to find ways to align our resources so that our cost to revenue ratio comes down significantly. So another thing that the strategic plan talks about this year is actually the journey of the strategic plan from year one to this year is actually on staff matters. And what have we been able to do? Remember, we started with the HR audit. In 2016, an audit was done by Manpower. The recommendations were not implemented, or at least the audit that was done by PKF shows that it was implemented only to the tune of 20%. In 2017, we did 2 audits. We did the culture audit, which showed its own some of the issues that are going on, and we did the PKF HR audit, which has made strong recommendations, which is what informed what are the interventions in terms of staff matters in the strategic plan. One of them was people were saying they did not know what they were supposed to do, and therefore we developed clear job descriptions. In the same year, we began the journey towards, we did a salary survey, a remuneration survey, and it showed that we were at at the bottom quarter in terms of what we are supposed to be paying people. We've since done a lot of work in terms of salary survey, and believe you me, I know that Sangide, 2 people come and say, but he's been given this much, and me I wasn't. We are actually following what the HR auditor recommended. So it is not, we are not doing something out of the blues. We have been keenly looking at that sliding scale they developed and pushing people towards. So everything matters. Salary has been towards that. I know some of you have received massive shifts, some of you have received modest shifts, but it is all informed by something that was actually developed in 2017. It is not targeted or anything. In 2018, we then introduced, so this happened here, clear job descriptions was accompanied by the culture change that we did, including investing in our leadership. Then we did the salaries, and then we've done the balance scorecard, and then and the balance scorecard will go on, and now we plan to input it so that it's automated, so that we can actually measure the performance of how the movements are happening from a strategic level. And so in 2020, we want to focus on the remaining parts of what the strategic plan talks about. Last year we did a workload analysis, and we shall be talking about restructuring, realignments. There shall be some shifts here and there, people being moved from one department to another. They shall be outsourcing. This has already been approved by the board. We shall be informing you at departmental level, and there shall be standardization of work so that you don't have scales of people that are on different scales that are supposed to be doing the same job. So these processes are supposed to affect at least around 200 people. Through the entire process, we shall be as interactive as possible, as empathetic as possible, and we shall give as much information as possible and be as transparent as possible. But this has to happen for the strategic plan to come into fruition. So this will involve, like I talked about this, just a repetition, reviewing of contracts, resizing departments, and outsourcing for the non-core services. Why is this necessary? It is because it is a strategic question. One, they are clearly stipulated in the strategic plan. Number 2 is this animal that we talked about. For example, if I may just give you a snippet, the cost of a cesarean, studies have been done to show that the cost of a cesarean, in Kenya at least, some people talk about it being as low as 15,000 shillings. But in Kijabe, the cost, not the price, the cost of being a cesarean is 40,000 shillings. And Why? It is because of two big costs that we are looking at. One is the supply cost, two is the cost, the staffing cost, which contribute about 50%. Now, when we talk about, for example, healthcare costing, we are not talking about, or healthcare financing, we are not talking about the individuals that operate on the patient, but you're talking the entire system. How much does it cost to do business in Kijabe? It is on the expensive side of the spectrum. Why? Because we are a tertiary healthcare services, but then again, because we can actually do it in a better way. Then the other thing is that we have been pushed also by the hostile environment. For example, NHIF has insisted on capping at some level, so we cannot do any increments beyond that price that has been capped, and therefore this is why we have to relook at our costs. So the change will happen across the entire hospital. It will not happen only, there's a tendency for this to happen at the grassroots, and then Ukuju things stay the same. But I assure you that this process will look at the entire, from the directors to the managers to the staffing. And because of that, we have already looked at some of these areas, and we shall be coming to the departments to have this conversation, to have an interactive session, and to see the best way forward. All this will happen in the month of January. And therefore, with immediate effect, I would like to announce the revised organogram that will take place. So some of these positions remain the same. You have the name of, this was strongly recommended by the board. The name of the Director General changes to Executive Director. That is just semantic. It doesn't mean anything changes. But then you have the medical safety quality report. This line here, there's another line that this person reports directly to the committee of the board. And you know that this person is already in office. And then the internal auditor is already in office. I don't know if it's here. I don't know how many of you know him. I think he's been introduced. His name is Bet. Again, reports directly to the audit committee of the board, and then administratively reports to the Director General. And there are some offices which have come closer. This used to be a division, and it had its director. So one of the director's positions has been scrapped off. We have now corporate affairs reporting directly to the Director General, the business development, the project manager, and the information systems manager. This color is in green. It's a different color because he's in transition. It's a position in transition, which means in the next 2 years, once we stabilize, we shall be moving to one of these other departments, either Director Finance, HR and Planning, or the Director Support Operations. So I think they brought these people closer to support the DG because they determined that the DG is a bit incompetent. So he needed a lot of people to support him. Now, this is where the board has been doing a lot of work. The directors will essentially reduce in number. How many directors were there previously? Huh? Anyone? Anyone? How many directors were spelled out in the organogram? Oh, okay. There were 8 directors. They will be reducing to 4 directors. Okay? So the restructuring begins at the top. We shall move from 8 directors to 6 directors. From 8 directors positions to 4 directors positions. How did we, when this was being developed, we thought about the different, the directors previously were directors of representation. But we've moved from that direction, we've moved to directorships of service. So we look at service areas. The first service area is education. So we want all matters education to be under one director. Therefore, we shall be compressing, we shall remove the graduate medical education director, and we shall remove the principal as a directorship, and we shall have just one directorship called Director of Education. And all these, the division of the graduate medical education and the division of the Kijabe College of Health Sciences will be merged to be one. Why is this important? It is so that it is our movement towards the university. Remember that we've been talking about this. So we want that when one person is in charge of education matters in Kijabe. So we don't want to have two. We don't want to have representation. We want to have a service line. A service line in Kijabe called education, matters education. So effective immediately, we shall have one director called Director Education. The next, support services remains the same. It was already compressed. Remember previously, in the previous organogram, there were some positions that were all over the place, but they've been now compressed to be support services. The third is the Director Clinical Services. The name might stay, but the position is not the same. The Director Clinical Services, again, we toyed about changing the name so that it doesn't seem, for example, that we are trying to eliminate one directorship and retain one, but actually the name might stay, but the services change. We toyed about calling it Director Patient Services, Director Medical Services, or whatever, but we thought that this would be the best. It still made sense. This one is in charge of all matters patient. So there will be no longer nursing and clinical services. When a patient comes to Kijabe, and if something good happens or something bad, we want to hold one director accountable. Remember, when a patient comes to Kijabe, and they're in the ward, there's this famous story that of when they tried doing this in a hospital called Baptist Memphis, and they had done separation of services. And on the bedside of each patient, there was this, it's called what? The calling thing button. Yeah, it had four. There was, if the patient wanted housekeeping, there was a button for housekeeping. Bonyeza. And then if a patient wanted a doctor, there was a button for a doctor. If a patient wanted nurses, there was a nursing services, there was a button for that. If the patient wanted counseling services, there was a button for that. What they quickly learned was that if the bell for the, let's say, nursing services went on, and a doctor was passing by, what would happen? The doctor would say, "It is not me being called. It is the nurse." And what do you think that did to the customer? The customer satisfaction went down, right? So they eliminated that and said, all services patient will have one button. When a patient calls, it doesn't matter whether it is for linen, whether it is for that, the patient needs to be responded to. So it is in the same philosophy that we have moved from calling nursing, and medical services. We are aligning so that we deliver on patient-centric. Remember the strategy that talks about patient-centric services? We want to hold one directorship accountable. So this position will be in future filled by either a nurse or a doctor, but it will be one director who is in charge of all matters clinical, all matters patient. We thought that also because, and the final is the Director Finance, HR and Planning. We shall be, with immediate effect, the Finance, HR and the Finance, HR and all those that fall under will be merged into one service so that we have one director for that. Why is this important? Because you cannot talk about any HR interventions without finance, because HR constitute 50% of our expenditure. Number two, you cannot talk about planning without talking about HR, because anything we plan involves people, and therefore we thought that this would all fall under one director. So essentially, the restructuring begins at the top, and this takes place with immediate effect. Now, to put faces into this, unfortunately, this man stays. The Director Clinical Services The position name may stay the same, but remember I told you the position changes. Therefore, the nursing services and the clinical services shall be reporting to one director, and that director is Dr. Evelyn Bugwa. And because of the magnanimity of the position of, now because it's this will be from the clinical side, magnanimity of the other division, which for example in this case is the nursing position will have a deputy directorship position, and the name changes from nursing director to nursing superintendent. The position of director finance, HR and planning will be kept by Josephat Wanyweke. We are in the process of recruiting. We have already begun the process. It will be done by an independent party. To replace, to have a final, a definitive director by the end of March. We should be having that position filled. The support services director, acting capacity remains Isaac, but we are in the process of transition, and I shall be announcing this position in the next week. This position will be filled. We will have a definitive head. A transition period will happen, and as of April 1st, we shall have a definitive head. This has already been determined. We are just working through some nitty-gritties before we can make the official announcement. And the director of education, this new position and new person becomes Dr. Pete Hallestrup with immediate effect. Please join me in welcoming these people, because they are now have an ordinance. It is a big task, remember, because now this person has actually a responsibility of handling what were formerly two positions. This has always been a big responsibility, and we know that this is now a big responsibility, because it combines two very big divisions, or two divisions with very big responsibilities. And obviously, again, please support this lady as much as possible, because again, it is a lot of work to run both the nursing, what was formerly the nursing division, and the clinical division, which are now effectively subdivisions. And therefore, this will affect many things. For example, the strategic team, which is the SMT, and the SMT changes. So these are obviously the directorship positions. So these four are automatic members of the SMT. We incorporate the spiritual affairs manager, who was previously there and stays on. Why? Because that's really our core business, and therefore we need to get close. We need to have the organizational consciousness seated with us right there. Anatuchapa kiboko, ukianza kuongea mambo mengine. And then we have the nursing superintendent, who will be seated at this deputy director's position, will be seated. Why? Because this commands a huge number of people, and obviously it is very critical for delivery of satisfactory patient service. This is a new member, the corporate affairs manager. Why did we determine to introduce her to the SMT, the position? It is because, again, this position, we are trying to bring the customer conversations closer to the table, so that the SMT is more responsive to customer issues. So I would like to conclude by saying this year we look forward to implementing the final phase of the strategic plan, so that next year it can just now roll over and things can take shape. Remember, this is really laying the groundwork for a future for Kijabe, for growth and sustainability, and also finally, that we shall come to the departments and communicate this effectively, and the changes that are going to ensue. And it is not done with any maliciousness. It is done with a lot of empathy, but it is for the greater good of the organization. And we shall have this collaborative conversations where we see how much we can engage empathetically to ensure that this process and these transitions move smoothly. And finally, it does not affect just a group of people. It will affect, number one, as I have demonstrated right from the strategic level, and number two, across divisions. The clinical division, the nursing division will be affected as much as the other divisions, for example, the various support services divisions. Asanteni sana, and I look forward to having interactive 2020 with all of you.